Hey everybody, Dr. Perry Bard here, and on behalf of Dr. Eric Kaplan, I wanted to share with you something that I know is something that you will benefit from, something that you'll have an opportunity to learn about, something that at the end of the day will give you the ability to do the most important thing, and that is to be able to deliver a much better patient result. Now, I don't know if you know this, but a couple of years ago, Dr. Kaplan and myself taught the only national peripheral neuropathy university certification program that was ever given through a chiropractic university. And to this day, there's not a week that goes by where we don't get feedback. I mean, you should see our email box in terms of just positive, uplifting, up-spirited, just good vibes about the information we put out there. And then as time went on, what we did was we decided to kind of package it, if you will, in a very distinct and a very specific way under a brand. And the brand, for as many of you know, is NeuroDoc Neuropathy Treatment Centers. And it took off. Little did we know it would be this popular. But I wanted to share with you some information here that is vitally crucial, vitally important in terms of your approach to peripheral neuropathy cases. Now, I don't know if you're like me, but when a patient presents to your clinic, often, as you know, not only do they have back pain, but they could have numbness, tingling, pins and needles. They could have gait issues, balance disorders, temperature issues. And often you don't know if it's a radiculopathy. You don't know if it is a spinal structural issue. You don't know whether that's a metabolic issue. And that's the best part of being a doctor, is to be able to prescribe the right test, to do the right analysis, to be able to formulate the best diagnosis that you can, to be able to guide your patient the best possible way. Because the reality is this: if you know anyone who's ever suffered from peripheral neuropathy, I can tell you right now that the quality of their life is not great. In other words, the quality of their life is really suppressed. And you're talking about people who, in other words, often can't put their feet on the floor when they get out of bed. You're talking about people or patients, obviously, that can't drive anymore. They had to give up the ability to drive. Why? Because they can't feel the gas pedal properly. So obviously, there's a whole other group of issues associated with that. In our universe, what we do is we break it down to the simple. And when we break it down to the simple, first and foremost, is we make a determination whether this is a biomechanical, spinal structural dysfunction, or whether this is a systemic, possible metabolic issue. First most important test right out of the gate is, as so many of you know, is an MRI. So in our world, our job is to make a very clear, clean line whether it is a disc problem, or whether it is a neuropathy problem, a nerve problem, or whether it's both. And in some cases, it is both. So what we do first and foremost is, one of the most important questions you can always ask your patients, number one, if they're a neuropathy patient, is the medications that they're on. Now, would you know, and I think a lot of you know this, that there are medications that are prescribed to patients for peripheral neuropathy that are not designed for peripheral neuropathy. And the success rate of these drugs, case in point Lyrica, case in point Cymbalta, case in point gabapentin or Neurontin, as you know, often is not the ticket, if you will. It's not the answer for these patients. One of the things that we do in our office is we use balance scales. We believe that if a patient is having a gait dysfunction, or is having, obviously, the inability to be able to discern different sensations. In other words, and remember, this is not just a lower extremity issue. Often this is an upper extremity issue just as well. So quantifying and qualifying the degree of neurological entrapment, neuroforaminal encroachment, whether there are annular fibers or there is a disc herniation involved, or whether it is metabolic in nature with regards to possible a diabetic neuropathy. So these patients have to be governed a certain way. They have to be treated a certain way. And we know that the best answers for these conditions are put together in what we call a package. So there's a combination of a number of different treatments, therapies, and I'm not going to spend this video on explaining what those are because, that'll take more than 5 minutes. But the fact is that when you're doing a neuropathy case, everything you do should be designed to increase one thing. And that one thing is circulation. You should always talk to your patients about the problem of suppressed circulation or decreased circulation and the benefits of having increased circulation, especially to the lower extremities. So there's so many things neurologically and technologically that we do in our clinics to increase circulation to the tissue. Some are done in the clinic, some are done at home, and it is a package. And the reason we do it as a package is because if you take peripheral neuropathy and you simply attach one diagnostic tool to it and then one type of treatment to it, your results will be at a certain level. But if you, big word here, you ready? If you stack your treatments accordingly and appropriately based upon the patient's age, the patient's presentation, the degree of damage to the tissue space, and if there are other issues involved, that is the magic of being a great neuropathy physician. And that is one of the things that we teach, we show, we share, we do, we create, especially at neuropathy or neurodoc neuropathy treatment centers, which is the cousin of something that you may know of, which is the most popular treatment, or I should say most popular brand in the history of our chiropractic profession for non-surgical disc care, which is Disc Centers of America. And I don't know if you ever heard this, but all roads lead to disc. And when you're talking about whether this is a disc case, because a lot of times patients will come to Disc Centers of America and it'll truly be a full-blown neuropathy case. Other times they're coming and it is a full-blown peripheral neuropathy case with disc involvement, and sometimes it's just spinal disc involvement. That is the fun and the magic of being a great doctor, using the right diagnostics, doing the right case history, digging into their medical history, especially with the medications, because there are so many medications that can cause peripheral neuropathy. Yes, and to be able to give a patient back their quality of life, that is what it's always been about. And especially if you look at the demographic of peripheral neuropathy patients, it's not a secret, as you know, that these patients often could be 60 years old, 70 years old, 80 years old, 90 years old. However, when you look at a disc case, as you know, those cases could start as young as a patient in their 20s who has a herniated disc, blown disc, prolapsed disc, protruded disc, sequestered disc, and more. So it is the combination really of the two, because if you are in the disc market and if you are in the nerve market, trust me when I tell you that you can enhance quality of life to more patients than you could possibly ever handle. We teach you how to capture that market share. We teach you how to brand yourself correctly. We teach you how to position yourself, how to educate patients in terms of peripheral neuropathy and more. If you're fortunate enough to be able to grab a seat at the #1 training event that Dr. Kaplan and I are so thankful and so blessed and really so honored to be able to give to our profession, known as the Chiro event. My highest recommendation would be try to go to www.thechiroevent.com. And if you're able to grab a seat at thechiroevent.com, I got a special gift for you. Totally non-planned. I promise you, totally non-planned. But what the heck? We're talking about it, so let's make it fun, right? Let's make it fun. We started this video, as you know, talking about the National peripheral neuropathy certification, which was only a one-time training that was given at a chiropractic university. And then what we did was we took those tools and we took that information and we basically put it together in a whole package. If you're able to get a seat at the Chiro event, our gift to you is we will actually give you that actual manual. It is over 250 pages of peripheral neuropathy, education, research, training, and more. Our gift to you, if you're able to grab a seat at the Chiro event, that's what we do at the Chiro event. We wow you. In other words, you come expecting a certain thing, and then we just wow you. And we give you fun stuff. We give you amazing tools. We give you content. No pressure, no obligation, nothing to sign, no contracts. This is an opportunity to learn about how to raise your game as a nerve specialist, as a disc specialist, and really as the go-to doctor in your market that can really enhance quality of life. As chiropractors, what are we in? We're in the quality of life business. Try to grab a seat. We've got so many cool gifts for you if you're able to grab a seat at the chiroevent.com. Be the nerve doctor you've always wanted to be, the nerve specialist, the disc specialist, and the doctor that you've always dreamed about becoming, because trust me when I tell you, it's all inside you. It just has to, it just has to be released. That's what we do at the Chiro Event. We give you tools and we give you so much more. Go to the website, www.thechiroevent.com. We hope to see you on behalf of the incredible Dr. Eric Kaplan. I can use a lot of superlatives about him. You know that. I can talk about him all day long. On behalf of Dr. Eric Kaplan and myself, we hope to see you at the Chiro event. Try to grab your seat right now. I don't know if it's on here, but grab it now. www.thechiroevent.com.